So, did you hear about that study on how social deprivation affected COVID-19 infection rates in France?
Oh, you mean the one that analyzed data from May 2020 to April 2021?
Yeah, that's the one. It's fascinating how they linked area-based deprivation to higher SARS-CoV-2 incidence and positivity rates.
Hmm.
It's like the more deprived an area, the worse the outcomes.
Right, and they used the European Deprivation Index, didn't they?
Exactly. They assigned a deprivation score to each area using the
Yep.
EDI. And get this, they found that in the most deprived areas, the incidence rate was significantly higher.
That's really concerning. But what's even more surprising is that testing rates were lower in those areas, right?
Yeah, despite free
Yeah.
testing being available to everyone, it seems there were structural barriers preventing access.
Do you think it's just about access, or could there be other factors at play?
Well, they did mention factors like overcrowded housing and occupations that can't be done from home.
Right.
So, these communities had higher exposure risks.
Makes sense. And during lockdowns, those inequalities only got worse.
Exactly. Lockdowns increased disparities because people in deprived areas couldn't isolate effectively. They had to keep
Mhm.
working in frontline jobs.
It's like the pandemic magnified existing social inequalities.
Yeah, that's a good way to put it. And the study really highlighted how the social residential environment impacted infection rates.
But didn't they also find that in sparsely populated areas, the incidence was actually lower across all deprivation levels?
Yes, that's interesting, isn't it?
Yeah.
It shows that population density played a big role too.
So, in densely populated deprived areas, people were hit the hardest.
Exactly. And the positivity rates remained higher in these areas even during the second and third lockdowns.
Right.
It suggests that the measures weren't enough to help the most vulnerable.
That's really troubling. So, what do you think could have been done differently?
Well, the study suggests that without considering social inequalities, national prevention policies might actually increase disparities.
So, targeted interventions in deprived areas might have helped?
Exactly. Providing better access to testing and healthcare, and supporting those who couldn't afford to stay home.
But isn't it also about communication? Maybe the messaging didn't reach these communities effectively.
That's a great point. Health
Mhm.
literacy plays a huge role, and the study mentioned lower levels in deprived populations.
So, if people don't understand the measures or can't act on them, they're left more exposed.
Exactly. It's like setting up a safety net, but some people can't reach it.
Yeah, and that's a failure in public health policy.
Absolutely. The study emphasizes the need for surveillance systems that include social variables.
Right.
That way, policies can be better tailored.
But wait, didn't France have universal health care? Shouldn't that have mitigated some of these issues?
You'd think so, but the study found that even in countries with universal health care, inequalities persisted.
Huh, that's a bit counterintuitive.
Yeah, it shows that access isn't just about availability.
Yeah.
There are other barriers like socioeconomic status and health literacy.
So what can be learned from this moving forward?
Well, policies need to address these structural issues.
Right.
Otherwise, any crisis like this will just hit the most vulnerable the hardest.
Agreed. It's like we're only as strong as our most vulnerable communities.
Exactly. And investing in those communities benefits everyone in the long run.
You know, it's frustrating that these lessons keep coming up, but change is so slow.
I hear you.
Yeah,
But studies like this one are crucial for providing evidence to push for that change.
true. At least we have the data now to back it up.
Exactly. And hopefully, policymakers will pay attention.
Let's hope so. It's about time we bridge those gaps.
Absolutely. The health of our society depends on it.